Hello, my name is Laura Brown, and I am the program coordinator for the Orthopedic Surgery Residency at the Center for Health Sciences and a second-year Healthcare Administration master's student. My research is titled Women in Orthopedic Surgery, How Medical Schools and Residencies Can Improve Gender Imbalance. In the United States, women make up 50% of medical students, yet only 15% of those women become orthopedic surgery residents. Orthopedic surgery continues to see the smallest percentage of females of any other surgical specialty, despite similar capabilities and qualifications of applicants in surgical and non-surgical residencies. As an ortho program coordinator, I noticed year after year that we had very little female applicants. So I wanted to know why female medical students weren't choosing orthopedic surgery and if osteopathic medical schools are inadvertently encouraging women to go into traditionally female-heavy residencies by not providing adequate exposure and mentorship in orthopedics. The goal is for medical schools, in conjunction with residency programs, to take this information and use the recommendations to help improve the rate of females into orthopedic surgery residencies. I reviewed 16 articles from various peer-reviewed journals. I went to the websites of 15 osteopathic medical schools and found their mission statements. From there, I used Word to perform a word count and also used an online word cloud generator. I requested data from the Oklahoma State University College of Osteopathic Medicine on the number of female students who matched into either primary care residencies or surgical residencies. The common thread throughout these studies was the importance of early exposure to orthopedics and access to female role models. Just under half of medical schools do not require education in musculoskeletal medicine, including orthopedic surgery. In one study, all respondents reported forming their career choice during their third and fourth years of medical school. However, those that reported being orthopedics bound made their decision prior to medical school and were strongly influenced by people and prior experiences. Of the students who chose orthopedics during medical school, 51% reported doing so prior to their third year. Bullying, inappropriate questioning during interviews, and bias seen during their audition rotations were also some reasons found that female students felt like orthopedics wasn't the right choice for them. There were also misconceptions about ortho, like that it was boring, too difficult, or that you had to be of a certain strength to perform the job well. Work-life balance was also mentioned, as some were concerned about the demands of the schedule, family planning, or the potential for a 3 or 6 month long out-of-state rotation. Now, when looking at osteopathic programs, in my analysis of the mission statements of the osteopathic medical schools, I found a focus on rural and underserved populations, as well as an emphasis specifically on primary care. OSU College of Osteopathic Medicine accepts 120 to 122 medical students a year, and from 2018 to 2022, you can see that in 2018, 30 female OSU medical students matched into primary care residency programs, and only 2 matched into surgery programs. 2019, it was 30 and 3. 2020 was 26 and 2. 2021, 34 and 4. And in 2022, with 28 and 4. 0 females matched into an orthopedic surgery residency. This data explains the drought of female osteopathic orthopedic surgeons being educated in Oklahoma and confirms that osteopathic programs struggle to cultivate female orthopedic surgeons as readily as its allopathic counterparts. Regarding osteopathic medical schools, research shows that the mission of osteopathic medical education emphasizes primary care practice and therefore could dissuade a female student from choosing orthopedic surgery, thus continuing to contribute to this shortage. So if you're unsure going into medical school of what kind of physician you would like to be, or if you have a preconceived notion about orthopedic surgery, you're more than likely to not have the opportunity to have your mind changed about it. Medical schools can modify their curriculum and clinical rotation requirements. Some schools offer the Perry Initiative, which is a hands-on introduction into ortho for female high schoolers, pre-med, and med students. Residency programs can promote female faculty into leadership positions or recruit female surgeons as faculty. And if you have a local school or feeder school like OSU, you can participate in their ortho club. Increasing the number of females in orthopedic surgery residencies will require efforts across all levels. For residencies to see diversity in their programs, it requires initiative from leadership, faculty, and coordinators to promote its attainability. A concerted effort must be made to modernize what an orthopedic surgeon looks like for the health of the program and the health of its community. These are my references, and thank you for your time today.